Hi, my name's Hailey Havrilla. This is my first year in the Science Internship Program for Nursing. I was in the Digestive Health Center at Hillcrest Hospital. I will be a senior at Avon High School this fall. And this summer I worked on a research proposal to submit to the IRB. So for my project, I did it on the process of an IRB proposal for evaluating pre-procedural anxiety. Our study will involve evaluating our patients' anxiety, pain, and discomfort levels in the Digestive Health Center before and after their procedures. We want to incorporate music therapy to help alleviate those feelings and provide a better experience for our patients. In order to help us implement music therapy, we are going to do a study to prove that music therapy will lower the patient's anxiety, pain, and discomfort levels. First, you need to look at what is being done now to evaluate the need for change and identify a problem. Our problem is that the patients seem to be having high levels of anxiety, which makes it harder for them to be sedated. This results in them receiving more medicine and taking longer to recover. This can negatively impact the patient's satisfaction and experience. Once you have identified the problem, you need to find out what you can do to change it. List out the possible alternatives to what is being done now. Decide on what you feel would work best. We felt that implementing music therapy would be a great way to help the patients reduce their anxiety levels. After you decide on what you want to do, you need to look and see if there are any other studies that have been done that relate to your study through literature research. Gather information from previous studies to get background information and significance. Make sure your resources are closely related and use the best support for your study. Assess how beneficial you think your study will be based on your knowledge. Once you have collected this information, formulate a hypothesis for your study. We researched many previous studies about music therapy helping to reduce anxiety, along with general information on music therapy. We use this information to give us a strong background and significance, which will give us more support for our study. This is how you plan to carry out your study. In here, you would include your type of study, sample size, criteria, research procedure, and consent if you need to. You would also include your resources such as equipment or evaluation tools. In our study, we plan to use a random controlled trial with a sample size of 100 people. The criteria for our study is strict in order to rule out vulnerable subjects. The research procedure includes using different questionnaires to evaluate pain, discomfort, and anxiety. Since the study includes human subjects, consent must be obtained prior to starting the research process. The proposal must include background, significance, study design, which is your methodology, sample, and research procedure, and then your data analysis, any adverse events that may occur, and consent if dealing with things such as human subjects. Once a proposal is formulated, it can be submitted to the IRB. You must wait for IRB approval before starting the study. For our proposal, we are waiting to submit to the IRB so we can hopefully get funding to implement music therapy in our department in the near future. I would like to thank my mentor, Jenny Houston, for everything that she's done and providing me a great opportunity this summer, and Hailey Powell, who is my co-mentor, and she's helped so much with the research and formulating the paper with me, and the whole Digestive Health Center staff who incorporated me in their team and were just very welcoming, and finally the Office of Civic Education Initiatives for allowing me to have this great opportunity. Thank you.